How to understand tricky TCM terminology. Imagine trying to read a map in a language you don't speak. That's what understanding traditional Chinese medicine terminology can feel like at first. Many words describe ideas that are quite different from Western medicine. They come from a worldview focused on balance, energy flow, and natural elements. To get a grip on these terms, start with the basic ideas. First, think about qi, which is the vital energy or life force that moves through the body along pathways called meridians. Qi is essential for health, and if it flows smoothly, you feel good. When it gets blocked or weak, health issues can happen. Next, consider yin and yang. These are opposite but connected forces. Yin relates to cold, rest, and substance, while yang is about heat, activity, and function. Keeping yin and yang in harmony is key to feeling balanced. Then look at meridians. These are channels where qi travels. Knowing about meridians helps explain how acupuncture works by stimulating specific points to help qi flow better. In TCM, organs are not just physical parts but also functional systems. The Zhang Fu organs include the liver, heart, spleen, lung, and kidneys. They have energetic roles that influence overall health, not just physical functions. When diagnosing, practitioners use frameworks like the 8 principles. These include yin and yang, interior and exterior, cold and heat, and deficiency and excess. These help classify symptoms and decide on treatments. Instead of focusing on diseases, TCM looks at patterns or syndromes. It aims to restore harmony by addressing the root cause. The 5 elements, wood, fire, earth, metal, and water, are also important. They show relationships between organs and natural phenomena, guiding diagnosis and therapy. You might hear about phlegm, which isn't just mucus but a sign of deeper imbalances. Heat and cold describe the nature of symptoms. Heat can mean inflammation or restlessness, while cold might mean sluggishness or pain that feels better with warmth. Terms like tonify mean to strengthen or nourish a deficiency. Clear refers to removing excess heat or toxins. Harmonize is about balancing conflicting energies or organ functions. External influences like wind or cold come from outside the body, while internal issues are caused by internal imbalances. Treatment methods are linked to these terms. Acupuncture involves inserting needles at specific points on meridians to regulate qi. Herbal medicine uses plants, roots, and fungi classified by their energetic properties, such as warming or cooling, to restore balance. External therapies like cupping and moxibustion stimulate qi flow and warm the body. To understand tricky TCM words, start with the basic principles and categories. Remember, many terms are metaphors or symbols for functional states, not physical objects. Think of TCM as a system that looks at patterns and relationships rather than isolated symptoms. Using glossaries or guides that explain terms in both Chinese and English can help clarify their roles in diagnosis and treatment. Appreciating TCM terminology means respecting its cultural roots and seeing health as harmony within the body and with the environment. This way, you see how language reflects a holistic view that connects body, mind, and nature.